Well, hey everybody, it's Sandy and welcome back to my channel dedicated to helping you advocate for your own health one topic at a time. Yes, I'm back, guys. Sorry, I was gone for a while. When I got my cast off after my CMC tendon transfer and suspension plasty, it has been pretty hard for me since it was my dominant hand to deal with things like electronics, editing. So I'm actually using the phone so I don't have to do much editing. It's just been hard for me to be at the computer, and that's why I've been missing also from the Facebook group quite a bit. But I think I'm doing much better now. I also had a little struggle. I had a post-operative infection, not at the thumb, not with the surgical site, but I got C. diff, unfortunately, from the antibiotic they gave me prior to surgery. I think that plus being just very run down going into surgery. I don't know. It seems, unlikely from one dose that they give you of the cephalosporin, but nonetheless, that's what happened. So I've been recuperating from that, and that kind of took a lot out of me. Fortunately, I didn't have a case that was as bad as a lot of people's. A lot of people are just really debilitated for months. I think that's largely because I got Difficid, which is a newer drug that really, in my opinion, should be the first choice, but very often insurance companies make you use cheaper options and then fail those. And by that time, you're feeling pretty sick. So I was really fortunate that I got on the Difficid right away. So I didn't have a lot of making up to do in terms of fluid loss and whatnot, but my GI tract is still recovering. I guess it takes a while for the colon to settle down, and a lot of people after C. diff get some post-infectious irritable bowel. So I might do some other videos on that just because I've learned so much in that small journey. So let me know if you guys are interested in that. But as far as the hand, I have gotten lots of questions about how the hand is doing. So I've been wearing my arthritis gloves. So I took it off here so that you can see this one. So I've got some marks here just from the gloves, but I'm going to try to give you a close-up. The incision is healing so beautifully you can barely see it there. I've got to get real close up. I have been doing some scar therapy where I get something with cocoa butter or some nice thick cream, just very little bit because I don't want it to slip. I want a little traction, and I massage it in and I move the scar around. Of course, you have to do whatever your occupational therapist says because you don't want to do that too soon. It has to be adequately healed before you can start mobilizing it. And then I am also putting Kelo Cote on it. There's a couple of different scar preparations that I think are excellent. One of them is Kelo Cote. A lot of the plastic surgeons use that. So when I'm done with the massage with some moisturizer, I add a little bit of Kelo Cote. I do that twice a day. And the Kelo Cote is basically a silicone preparation, and silicone I think is the only substance that's been shown to really reduce the scarring, the keloid scarring. Now I'm not much of a keloid scarrer, but certainly I will. You can see some of my old burns there. That area is white. It will stay white as other areas brown, and this area on the hand being a tight area, I just wanted to make sure that I take as good a care of that scar as I can. So I did go ahead and use that Kelo Cote. What the silicone does is it sort of sends a message to the cells around here. It locks in so much moisture that they get a message that there's no need to lay down a whole lot of extra collagen, which is extra like scarring tissue basically. And if you do that really religiously, I have found that I've had excellent results with scars, with having had other scars before where I used it. So Kelo Cote is one of the options. There are a couple other ones if you look on Amazon, but I've just had really good luck with Kelo Cote, and I'm going to link something down in the description box for you. Yeah, so I do that twice a day. I do the scar massage often when I think about it. I also make sure to put sunscreen on this, guys, because of course sunscreen, just for the reasons I just said, this area will not darken. And so if you burn around here, first of all, it's still very fragile. It took a while I had some burning at the site anyway. That seems to be calming down now, but I just don't want to damage the skin there. So I put some SPF on there, a zinc one. I don't want to use a chemical sunscreen on there. Up until now, I've pretty much just used physical sunscreen on my face, and I do use chemical sunscreen elsewhere on my body. But just because this is so fragile and delicate and it's brand new skin that's just had surgery, I am using the physical sunscreen that I use on my face, and I just put a tiny bit of it there. Now, I also had people ask me, not only what am I doing with the scar, but they asked me to show if there's some difference between this is my left, even though it looks like the right to you guys, which was done a year ago, and this one, which was just done almost 2 months, like a month and a couple weeks ago. So a month and 2 weeks, 6 weeks. So yeah, I don't know how easy this is going to be to show you on camera, but if you look from the side, when I stretch out and extend the thumb here on the one that's healed well, it's pretty much, I mean, it's not way back here exactly in line with the hand, but it's very close. Whereas this one is still pretty far out here. So that's normal. And people had asked me about that, if I experienced that. And in my recollection from having done this side and gone through all the therapy, that takes a long time. Right now, I'm still in the first couple weeks of occupational therapy, and usually the first couple weeks is just devoted to getting it moving because it's been immobilized. So some stretching, mobility, turning the wrist and things like that. I'm doing things like that simulate what you have to do when you extend and flex the wrist, because this was all immobilized in the cast. It's not going to be for a couple more weeks that we start working on strengthening. And in my recollection, that's what starts to, bring this in line. And eventually, you can actually place weight on the hand. So this one I can place all kinds of weight on. I can do a downward facing dog in yoga. I've been able to do that for many, many months now. Again, in my recollection, that's going to take a while for this one. First of all, it's still pretty sore right here. This is where the surgery took place, and under here between where my fingers are. But that's going to have to sort of flatten out a little bit. And some of that comes into play when they have you start stretching the muscles on the opposite side. So almost like back bends for your hands and things like that. So I will keep you posted. As far as the range of motion, it's really been pretty good for me. I was a little surprised because it was better, even though this side is my right hand, my dominant hand. It was immobilized, and I really expected this to be so much worse. I think because the cast was so low down here, I kept a lot of this stuff moving really well. The one thing I am having some trouble with, and any of you who've had this procedure, let me know if you have. I found this the last time too. This knuckle and the long bone right here, this has really taken a beating. And I'm going to see my surgeon in another week and a half, and I'm going to ask him what we can do about this. My occupational therapist thinks that just from the immobilization that I've probably got some arthritis in this joint that's acted up. And for sure, it seems like, it seems a bit swollen right there. Now, I'm able to move it. I'm able to stretch it. It feels pretty good when I do stuff like this, and even like this, when some of it I'm feeling like between, like I said, along the long bone, so between the knuckle and the wrist. But what's really hard is to completely straighten it back. Now, I think it is getting better over the last week or so. I think I find that it's doing better. I have been doing more without the brace on. I have been swimming a lot. Now, I don't mean like swimming laps and really pulling myself with this, but I am doing a lot of movement through the water, and I find that I can, push harder and do it longer and things like that. And I've been spending a lot of time in the pool, so I think that helps a lot. But I definitely have found that just immobilizing, this is one of the trade-offs when you immobilize something. If you're 25 years old, none of this matters. But when you're in your 50s, whatever, I'm 57 now, I think having this having been immobilized for a few weeks, even just 3 weeks, actually it was closer to 4, because there was a week of the dressing before the cast went on. I just think it sort of took a toll here, and this is something I'm going to have to address, because this is giving me a challenge, like where the thumb is getting better and better every day. I can already move this all the way down here. Some of the things you have to do where these fingers, the thumb and this first finger, work together are very difficult for me, and it's really because of this, I can tell. So all the thumb exercises in the world aren't changing that. So I did talk to the occupational therapist, and I'm also going to talk to the surgeon about that when I see him in a week and a half. The good news is I do think that's getting better, and the wrist is getting more mobile. That I certainly wasn't able to do that right out of surgery, and this was almost normal to begin with, but extending backwards was not. So all in all, I find that I'm the most comfortable if I put on my copper compression gloves. I talked about these in another video last year. There's all different kinds of these arthritis gloves. I've used Dr. Arthritis. I've used copper compression. I've used some others. I find that copper compression is really the best one. I think it's got a really nice sweet spot between compression and comfort. I do like the grippy stuff it has here in the palms. The really nice thing about it is the length. A lot of times, the length of the fingers is real variable with different people. So because of the width of my hand, I use a medium. I take a size medium. Ideally, gloves would come in like small, medium, large based on the width, and then long, regular, or short in terms of the length of the fingers, but they don't. So when you get sort of a one size fits all that has longer fingers, they're too long for me, and they're like almost up to the nail, and I feel like I'm just always getting them dirty and everything, and especially like my whole view of how to wear these since COVID has really changed anyway. So copper compression just has a really nice place where these are really short and they're down to, in me, the first knuckle there, and I think those are, they just provide a lot of support. So this is my custom splint, which I really haven't found that I've worn because it further aggravates that first knuckle. So I wear it very sparingly, but I find that it works well with the copper compression glove under it instead of the stockinette gauze. And yeah, although I don't have to wear this all the time, I'm allowed to take it off and just wear it as I need it. And I'm finding that I'm getting better and better as I wear it less and less and just wear my compression gloves. So yeah, that's the update. I'm hoping to be back now regularly. It's just, bear with me because it really is hard to, like, I'm still using a mouse with like my left hand and things like editing and typing, and it's kind of taken a toll on the hand. So I'm trying to be good to it, but I'm also trying to get back into it. So it's nice to be back, and I'll hope to talk to you guys soon and hear from you. Please put your comments down in the comments section. And until next time, be well. Bye-bye.